Hello, my name is Connor Epling, and I am in HUS 4442, also known as Addictions Family Counseling. The professor for this course is Dr. Valerie Richards Grant. This video is for a presentation due the 31st of March 2025, presenting a case study about the addicted family members of the movie Requiem for a Dream. In Requiem for a Dream, two characters, son Harry Goldfarb and mother Sarah Goldfarb, both struggle with addiction to substances. Harry dreams of living it big by dealing heroin on the streets with his friend Tyrone. Harry's girlfriend, Marion, also dips into heroin use with both of them, and is willing to degrade herself by exchanging pleasure for a supply of drugs. Sarah is an elderly widow obsessed with an infomercial television show. She is invited to be on the show, and in turn, she becomes obsessed about her weight. She gets prescribed amphetamines as diet pills, and soon they cause an amphetamine psychosis, leading her to a psychiatric ward. Main characters and their dynamics. The two main characters of the movie are Harry Goldfarb, the son, and Sarah Goldfarb, the mother. They have a slightly rocky relationship. Sarah has unconditional love for Harry and often puts him on a pedestal he does not deserve due to his actions. She is invested in his future heavily, occasionally bringing up the fact that she wants a grandson from him and his girlfriend. On the other hand, Harry sees himself as independent, trying to break the overbearingness of her love. The role I assigned Harry is the dependent role. He depends on others for his addiction, such as stealing the television from his mother and finding his next fix from his friend and girlfriend. Although he acts as if he has power, he truly lacks it and acts out when he can't get his next fix. The roles I assigned Sarah are chief enabler and dependent. For chief enabler, Sarah gives into his son's need for money. In the movie, her son stole her television and sold it for drug money. She then goes back to where Harry sold the TV to buy it back, and the seller suggests that she goes to the police for them to give him a good talking to. Sarah denies it, stating, "I couldn't do that. Harry's my only son. He's all I have." Her other role I assigned, dependent, goes deeper. She becomes dependent on the diet pills, amphetamines, that her doctor prescribes her. Her sense of grandiose from wanting to be on her favorite television show only makes her feel anxiety and guilt from being overweight. Addictions being addressed. There are multiple addictions in the movie from different characters. Harry, for example, is chiefly addicted to heroin, but also dabbles in cocaine, marijuana, and pills. Sarah takes doctor-prescribed diet pills that turn out to be amphetamines. Theories. What caused the addiction? Harry's reasoning for addiction follows the self-medication hypothesis. He uses drugs to escape negative emotions and situations. His addiction also follows the social learning theory. Both his friends and girlfriend use the same drugs he uses, especially heroin. For Sarah, her reasoning to becoming addicted is operant conditioning. She starts out taking the diet pills, amphetamines, for the purpose of losing weight, but soon becomes addicted to the way they make her feel. When the prescribed dosage doesn't react the way they used to, she takes more in order to feel that normal feeling. Assessments and interventions used in the movie. There is no assessment or intervention in the movie for Harry, but he does lose his arm due to an infected needle site in his arm getting out of control. This could possibly be a wake-up call to stop his addiction. Sarah, on the other hand, When induced into amphetamine psychosis and goes to the television show's production address, she is assessed by paramedics who take her to the hospital to treat her for her addiction. She is then placed in a psychiatric hospital to help her psychosis and continue treatment for her addiction. Near the end of the movie, it is shown that they use electroconvulsive therapy on her in order to try and cure the psychosis. Models and interventions useful for Harry Goldfarb. Individually, the trans-theoretical model would benefit heavily for Harry. The pre-contemplation and contemplation stages would help him realize why he is addicted and how it could affect him in the future. The preparation stage would set him up for ways to stop his addiction. This can be through learning new coping mechanisms and reframing thoughts and avoiding situations that trigger the addictive behavior. Then, the action stage is him putting said efforts into action. He would need to exercise said coping mechanisms. The maintenance stage is the hardest. Relapse is part of the recovery process, and due to him using drugs for a long time, it wouldn't be surprising if he relapsed. Lastly, the termination stage is set and he can be fully drug-free. To do this, he would need to find new sober friends and engage in healthier activity. The best intervention for Harry is offering feedback through the FRAMES technique. FRAMES stands for feedback, responsibility, advice, menu, empathy, and self-efficacy. This technique offers non-judgmental, insightful feedback that can then empower the client to build a sense of responsibility and give them different options to tackle their recovery. Models and interventions useful for Sarah Goldfarb. For Sarah, motivational interviewing would be really successful. It would identify why she sticks to the diet pills and amphetamines, and what interventions would be useful in maintaining soberness. She can find her own reason to change and realize that her grandiose ideas that spiraled from her amphetamine psychosis are dangerous for her and her mental health. She struggles with eating due to the fear of gaining weight, and she can find her own motivation for safely, responsibly losing weight. With motivational interviewing, Sarah and the counselor can build rapport and trust with each other, creating a non-judgmental and empathetic environment where Sarah can openly explain why she feels a certain way without having labels or quotas. Motivational interviewing also fosters autonomy and self-efficacy, letting the client know that their decision is ultimately their own decision and reduce their resistance to change. Models and interventions useful for Sarah and Harry together. Together, with Sarah and Harry both struggling with addiction, I believe they would benefit from cognitive behavioral family therapy. They can both address their problems their drug use has on each other and work and figure out what are the triggers for each incident of drug use is. They can learn to reframe thoughts that trigger addictive behavior and promote active listening and communication between each other. Both Sarah and Harry can explore new options and coping mechanisms and share what they believe helps beside drug use, helping each other out and giving them a shoulder to lean on. The ABC method, standing for antecedent, behavior, and consequence, can also help them realize what causes the trigger and how they can shape how to respond to it. This method can benefit them through stopping and reprocessing. When the trigger is identified, one can then change their behavior and stop the consequence from happening. Barriers. Before losing his arm, Harry never believed his drug addictions were as bad as they actually are. He has a lack of motivation for change and a denial of his problems. He uses heroin as an escape for his pain and is codependent on his girlfriend and friend for his addiction as well. Despite having an infection in his arm, he uses heroin and even injects it in the same infected place so the vein doesn't blow out. With visions of grandeur, Sarah would have trouble grasping reality that has been muddied by her amphetamine-induced psychosis. She clings dearly on being on her favorite television show and may have resistance to change. She is also not aware that she is dependent on the drugs, mostly due to the fact that it was prescribed by her doctor. In the movie, when Harry confronts her about using the amphetamines, she says he isn't smarter than her doctor. Resources the client could use. There are multiple resources Harry and Sarah could benefit from. The first is Right Life Services. With multiple options in Port St. Lucie alone and one in Okeechobee, Right Life offers Alcoholics Anonymous and Narcotics Anonymous services free of charge. There is also the Counseling and Recovery Center Incorporated and New Horizons of the Treasure Coast in Fort Pierce. Central Florida Treatment Center offers individual, group, and family counseling as well as medication-assisted treatment for opioid dependency and methadone or Suboxone therapy. Summer House in Miami is a detoxification center. If in Florida or anywhere else in the United States, one could call SAMHSA's National Helpline. They are a free treatment referral program intended to curb addiction.